Tonight, the first signs that the Omicron surge may be waning in major cities in the Northeast.
Cases are slowing down. The rate of increase is slowing down.
New York's governor sounding cautiously optimistic this week as COVID infections in the city dropped for the first time since the Omicron wave began.
We are not at the end, but I want to say that this is, to me, a glimmer of hope in a time when we desperately need that.
Glimmers of hope across the region. In Boston, COVID levels in wastewater are down nearly half from peak levels 2 weeks ago. And in Philadelphia, the positivity rate dropping for the first time in months from 45% positive in the last week of December to less than 20% most recently. Here in New York City's Times Square, this is what testing lines looked like less than a month ago. Now, those lines nearly non-existent. The city's positive case count, while still high, down dramatically.
These past few weeks, we have been noticing a huge decrease in the lines. We used to have lines that go all around Times Square, testing over 300 to 400 people a day in each location. And now we have 150 or 200 people tested daily.
If New York City is peaking, what do you think that means for the rest of the country?
I really think that this is hope.
But we're not there yet. From New Hampshire to Nevada, states are still battling the worst of it, shattering records. Nationwide, more than 800,000 cases per day. Roughly 20 states with less than 15% of available ICU beds. One hospital in Virginia now treating patients in a parking garage.
We're out of beds completely.
Alabama setting a record for child hospitalizations. 90% of kids ages 5 to 11 unvaccinated. Pediatric cases at this hospital have tripled in the last 3 days.
Sore throat, congestion, cough, difficulty breathing, flaring out of the nose while you're breathing.
The death toll still around 2,000 per day across the country. A hospital in Indiana now using a mobile morgue, bracing for unimaginable loss.
We're experiencing so many more deaths than in a typical January. So that's the sad state of affairs we're in right now.
Experts say Omicron appears to be more mild in symptoms, but not among the unvaccinated.
About 70% of our hospitalized patients are unvaccinated, and it's closer to 90% that are on ventilators in the ICU. Because there is no vaccine protection, the odds of death are greater here, and this is something we need to prepare for.
All right, Pricilla Thompson joins us now live from a testing site in Times Square. Pricilla, we know testing obviously one key to curbing the spread of Omicron. Another, of course, is masking up, making sure you keep your distance from some people. The CDC is out now with a major new update. I know you have some new reporting.
That's right, Tom. Within the last hour, the CDC saying that people can now choose whether they want to wear an N95 or a KN95 mask, saying that both of those provide excellent protection against the virus. And what they're saying is they're not telling people to choose one or over the other. Instead, that they're saying either mask will work. You really want to go for the one that fits you the best and that you're actually going to wear consistently. And of course, this is a reversal from what we were hearing early on in the pandemic when the agency was discouraging people from using those masks for fear that there wouldn't be enough for frontline workers. But they are now saying that there is no fear of a shortage. Tom?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.